In this video, we discuss the use of ablation in cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 – Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Ablation in the context of cancer means the removal or destruction of a body part or tissue or its function. Ablation may be performed by surgery, hormones, drugs, radiofrequency, heat, or other methods. Ablation is an underused method of destroying solid tumors. Stereotactic radiation, a form of ablation, is discussed in our radiation video. Types of ablation. The most basic form of ablation is ethanol ablation, which has been used in humans against cancer since the mid-1980s. This involves directly injecting ethanol into the tumor. Because of its cheap price, it is most commonly used in the developing world. The next form of ablation is radiofrequency ablation, and very similar to that is microwave ablation. Both radiofrequency ablation and microwave ablation use heat to destroy a tumor. Radiofrequency ablation was first used in humans in 1993 on liver metastases and microwave ablation in 2000. Cryoablation uses extreme cold to destroy tumors by transferring supercooled fluids to the tumor through a hollow needle. Cryotherapy has been used in humans for oncology since the 1960s. In 1968, a Japanese physician, Dr. Shigeo Tanaka, began treating breast cancer patients who had previously been deemed incurable with cryoablation. In all cases, their cancer was advanced, unresectable, and resistant to radiotherapy, chemotherapy, and endocrine therapy. Over the next 27 years, he obtained a 44% 5-year survival rate in 49 patients. All forms of ablation are normally performed as outpatient procedures. The downside of ablation is that it uses necrosis to destroy the tumor, as opposed to apoptosis. This means the metabolically dead tumor will remain in the body until it is cleared out by the immune system, whereas if a tumor is killed via apoptosis, it is cannibalized and removed from the body. Naturally, the hope is that once a tumor is dead, it will be easier for the white blood cells to attack it and remove it from the body. However, many times necrosis from ablative and radiotherapy treatments can become a long-lasting problem. Efficacy between types of ablation. The best way to summarize the efficacy of the different types of ablation is to reproduce a chart from the article Effects of Radiofrequency Ablation versus Other Ablating Techniques on Hepatocellular Carcinomas, a systematic review and meta-analysis by Luo et al., but it is 30 rows by 12 columns and far from being easily comprehensible. You are welcome to examine it for yourself, but we believe it indicates that radiofrequency ablation and cryoablation have roughly equal efficacies, while radiofrequency ablation has a slightly lower chance of side effects and cryoablation has what appears to be a slightly higher chance of an abscopal, system or body-wide effect. Ethanol is about 4/5 as effective as the other two. Additionally, if you're paying for the procedure out of pocket, radiofrequency is much less expensive than cryoablation. For this reason, we believe radiofrequency is more common than cryoablation. Insisting on cryoablation could also slow down treatment. Immune effects of ablation. This is a key difference between surgery and ablation. Ablation can have a positive effect against your cancer throughout your entire body. Certainly, there is inflammation due to the procedure, but this is outweighed under normal circumstances, by the benefits conferred. When the ablated tissue enters the bloodstream, white blood cells become more adept at identifying it. Immune escape, the ability of cancer cells to avoid detection by white blood cells, is a central problem in cancer treatment. See our blood filtration video for more information. In one study, melanoma patients who were refractory to an anti-PD-1 immune checkpoint inhibitor, that is Keytruda or Opdivo, had cryoablation performed on tumors at various locations in their bodies. The partial response rate was 17%, and the stable disease rate was 31% for a disease control rate of 48%. If these people had continued just using anti-PD-1 drugs by themselves, many would have passed away, as they were refractory to anti-PD-1 medication. Similar responses have been found with radiofrequency/microwave ablation. It is important for ablation to be combined with another immune therapy. For instance, in a mouse study, one group had cryoablation of a tumor and another group had cryoablation and an immune therapy. When the mice were re-challenged with cancer, meaning they were injected with something to give them cancer again, 30% of the cryoablation group overcame the re-challenge, while a full 90% of the cryoablation immune therapy group did. Surgery versus radiofrequency ablation. If a tumor is larger than 3 centimeters, surgery typically has better outcomes, but if the tumor is less than 3 centimeters, the outcomes are similar. This is why we're saying ablation is underused, because when someone is being monitored for cancer, just about all metastases that arise will be caught before they reach 3 centimeters. Additionally, the patient's immune system will be improved far more with ablation than with surgery. For more information, please see Cancer Self-Defense 101. Quick tips to help you survive.